Okay, I think Mr. Ben is not available right now. Let me nominate Patience. Please, can you share something about yourself? And then nominate someone else to follow you. Thank you.
Hello, my name is Kabaraha Patience. I'm in Uganda. I also have lupus, and I really look forward to hearing what the speakers have to say in this meeting.
Thank you, Patience, for being brief. Can you nominate someone, please?
I need to be. So na Zoom call. Zoom. Was good. No. Something for what? Oh, for this disease I have. Yeah.
Well, I think let me nominate myself since Patience is a little busy, I think.
Thank you.
Oh my God, I'm so sorry. My mic, I'm so sorry.
So should I go on with introducing myself?
Please go ahead.
Okay, my name is Dr. Lubega Ronald. I'm a Ugandan. I'm a public health specialist, but right now I'm venturing into something else. That is gyne oncology. Gyne oncology is, it's dealing with cancers, women cancers, ovarian cancers, breast, cervix, and all that. So that is oncology. Oncology means cancer, but also becoming an assisted reproduction therapy. That is assisting people to do the IVF of this world and assisting people to become pregnant. Thanks, and over to you.
Thank you, Doctor. By the way, many of these are our friends. I'm sure Mariam knows them very well. Okay, anybody else? I think we have just received a new person. Nantambi, please, and share something. Share your name, country, job, or area of interest. Would like to know more about you. Thank you. Okay, I think Nantambi is not available right now. Thank you for the chats. I'm seeing the chats are coming in.
Derrick, I think it is not Nantambi, it's Natabi.
Nata, okay. Thank you very much for the correction. What was that, Mariam?
It is you are talking about chia leaves, eh?
Okay, thank you for all the people who have shared in the chats. Thank you. Okay, so I think let us move forward. Thank you for all the introductions. Yeah, I can also see Natabi, who has also shared in the chat. She's from Uganda, just graduated. Perfect. Thank you, everyone. I think we can move on with the session. So first of all, I want to wish you all a happy International Rare Disease Day. Okay, the 29th of February is a very rare day. You can wave. Thank you. It's a very rare day on the calendar that Some years it's actually not there and actually appears during the leap year. So this day was chosen as the day for raising awareness about rare diseases. Okay, then to proceed, let me just share a few rules for the space. To start with, please use the I statement to share your experiences, because our experiences are different, they're not the same. So avoid actually use statements like I felt, my experience, or in my experience, instead of using statements like you will feel better if you do something, or if I were you. So just use our own experiences, our own perspectives to share more about what you have experienced, and not be and provide people with the privacy or confidence that they deserve to better participate in this space. If you're in an area, please try to find a quiet place where you can share your experiences so that we can hear you clearly. And if possible, please share your experience in a story form. That would really, really help us understand what you went through, what you're going through. And then we are going to have sessions whereby we shall share more about lupus, but then give you the opportunity to share recommendations that we can use, not only to address challenges that patients with lupus face, but also patients with rare diseases. So feel free to share as much knowledge as much knowledge as you have, because there is no really a right answer, you know. As you know, health is kind of broad, so you can look at it from your own health experience or a story you know about a rare disease and share what you have to share, which we can include in a report and align it with rare diseases. Okay, so thank you. Maybe let me start with Mariam, because Mariam and I haven't introduced ourselves, so we are going to do that next, and then we shall go into the definitions of the session. So Mariam, please, you can follow, and then I will introduce myself after that.
Yes, thank you, Derrick. My name is Mariam. I am a lupus patient, an advocate, and I do several other things. I'm a teacher, I'm a mother, and I have worked this journey of lupus for I think the last 15 years or so, because I started having signs and symptoms in about 2018, 2019. So, but I didn't get into active advocacy for lupus until I think 2016. That is when I started getting vocal about it. And ever since, I have been trying to advocate for lupus, talking about it, getting people living with the disease to come together, putting together different projects to generally bring us together, because the lupus community is a small one, and it is a very private place. People don't want to come out often and discuss it because it's not very well understood. But at the moment, yes, lupus patient, advocate, and juggler of several other traits for survival. So, but for now, yeah, that is it. Thank you, Derek. Oh, and no, sorry, before I forget, I usually forget, I don't know why I forget, but I usually forget that I'm the director also of Lupus Initiative Uganda, the umbrella that is trying to unite people living with lupus. And we bring people, of course, living with lupus together, or those who have been diagnosed or on their way to diagnosis. Yeah, so that is also Lupus Initiative. I'm the executive director there. Thank you.
Thank you, Mariam. In short, because we have really used too much time, I am Mpaji Derrick. I represent an organization called Might Foundation in Uganda, and we strengthen world peace, human rights, and sustainable development, specifically on issues of health like lupus. So we work in partnership with Lupus Initiative Uganda to raise awareness about lupus in Uganda, but we want to scale to include other rare diseases within Uganda, and probably also reach Sub-Saharan Africa with more funding. Thank you. Okay. Mariam, you did mention in your profile that you were because now we're going to the definitions, that you're Black, indigenous, African. What does that mean? And how can you compare it to being an African American or an African European? What is the difference?
The difference between African indigenous Black African, it's I am here, I am at home, I am at the cradle, I am in Africa, I have not moved away. When you say Black American, we are talking about the Black people living in America. Black European, the Black people living in Europe probably have been there for generations and it has become home. But when I say Black indigenous African, I mean I am here in Africa. This is where I am this. This is where I have grown. This is my home. And I think it makes me a bit different from apart from the color, my circumstances are different. My environment is different, of course, in terms of health systems, feeding, environment, climate, weather. So I do believe my circumstances are a bit different from the Black American or Black European. That is why it is important that I include Black indigenous. I am here. This is my home because all Black people are from Africa. So I am still at home and here. This is where I've been born, this is where I've been raised, and this is where I'm living.
Okay, thank you. I asked that because all the different sessions I've organized about lupus, they always ask, how different are you? Because there is research, practical research about African Americans or African Europeans. But when you talk about Black indigenous Africans, they tend to assume that we are also African Americans or Europeans, or we are in the same category. Yet the reality is that we are different and there's limited literature on Black indigenous Africans on the continent. So can you share something about decolonization? Do you have any idea about decolonization? Thank you.
When you say decolonization, there is what
in the sense of lupus.
In the sense of lupus. Oh yes, I do believe that generally the whole health sector, the whole health system needs an overhaul. We are living, we are independent, but we are still managed and controlled by the colonial system. I think it would be really, if we say decolonization, for example, if there is support for, let's say, people living with lupus, it would make more sense if we are empowered or we are in position to take control or charge of maybe research, data collection, all the steps that we need to go through in the process of maybe collecting data, understanding what lupus is as regards a Black indigenous African, as compared to when there is research, even when there is clinical research, you're going to see Black people, they are going to see Black Americans or Black Europeans. There isn't, the research is not trickling down to us in Africa. I don't know why, maybe because we don't have funding, or the organizations that are funded are not here. But if we could bring it down, we decolonize it and we become part of the research, part of the studies, because I do believe we have on the continent, on the whole continent of Africa, I do believe we have people who can do this work. We have rheumatologists who can do the work. We have people who can do this, but we are limited because we are not supported, and the research is not based on the African indigenous person. We are looking at the Black people as a whole, and yet, as I said before, our circumstances are totally different.
Okay, thank you for that amazing answer. And if I'm to add to what you've said, there is the research we get both as patients and as medical experts. I think we have a doctor here who can share more. Is from the West, most of it. Very limited. We have very limited research or literature on lupus in the Sub-Saharan Africa, which affects the whole region. So we need to change the scale so that we can also have donors give grants to our researchers in the region so they can also carry out lupus amongst Black indigenous Africans and also develop, as we shall talk about later, signs for Black people, which are actually not common. You actually have signs for white people. Okay, and then the other thing is donors working with white-led institutions. Okay, maybe they should now start working with Black indigenous-led institutions to raise more awareness about lupus. Okay, thank you. So Mariam, please take us through lupus. SLE Lupus. What is lupus? Whom does it? Which people are affected the most? And generally, introduce us to lupus as a rare disease. Thank you.
Thank you. You're making me feel like a doctor explaining lupus. But lupus is an inflammatory disease that is caused when the immune system starts to attack itself, and it doesn't discriminate. It cuts across all organs, the brain, skin, liver, heart, all tissues. It can attack any tissue. Kidneys, it does not discriminate. And studies show that it is caused by either environmental changes or genetics, and sometimes it could be hormonal. So the causes are not known. It is just assumptions. There are no clear studies that show that this is what triggers lupus. Sometimes they could be, if in case of environment, it could have been an infection or chemicals that you've taken or come in contact with. When we say genetics, it could be that your genes are predisposed to maybe be triggered by something and then you get lupus. So the studies are not conclusive, and lupus as a whole it's a confusing disease. From my experience with it, it's a confusing disease. It has symptoms that mimic other diseases. For example, those high fevers, the fatigue, skin issues. It would take you to dermatology. You think you have a skin disease, yet it is lupus. So the joint pain, you could think it is rheumatoid arthritis. It mimics so many other diseases. That is why, in my experience and the time I've spent with lupus and studying about it and reading about it, it is hard to diagnose. And when you come to our Africa, where especially we are prone to several other diseases that appear, like whose symptoms are mimic, you find that it becomes even harder. For example, at first I thought it was chronic malaria, then it could come down to ulcers, then rheumatoid arthritis. So everybody keeps guessing typhoid, and they keep treating these other symptoms without actually coming to the core of the condition, because in most cases we have no idea what is wrong with you, because even the tests that you need to do, unless you get an expert, it will take you forever to find out what is wrong with you.
Thank you, Mariam. Let me just stop you there. So first you've said it's a disease that causes the immunity to accidentally attack healthy cells of the body. What I could add to that is that it affects mainly young women of the child during the childbearing age. That's around 15 to 40, but then it can affect anybody at any age, including children. These women are normally young women and also youths. I think actually young women, but then also children. And children, there is not so much research about children in the Sub-Saharan Africa. You also talked about the causes, which are unknown. So it's mainly genetic, environmental, or hormonal. And then you also talked about the signs. So I wanted us to go deeper into the signs, Mariam. Which signs and symptoms? After you talked about fatigue, talked about fever. Then I could add to that the light sensitivity. So people need to wear sunscreen. And unfortunately, here in our region, people tend to think that having a black skin or pigment is something that protects you from the sun. Yet with diseases, it really doesn't matter. Of course, joint pain. Now, I want you to focus more on the signs. of lupus, Mariam? What are the signs of lupus? Those are the ones that are seen by a doctor physically. Thank you.
As you said, and the rules that we are going to follow, I'm going to say in my experience.
I'm sorry,
In
let me
my
just interfere a little bit. The reason why I'm focusing so much on signs is because as they're diagnosing lupus, they really focus so much on the signs. It's a sign kind of based disease during its diagnosis. So it's important to understand the signs of lupus. Thank you. You can proceed, Mariam.
Okay. Some of the signs of lupus, we have hair loss. There is the rash, the butterfly rash, although it is more pronounced, more significant in people with lighter skin. I will say fortunately or unfortunately, my skin is a bit lighter than most, so mine was quite visible. You could clearly see, but when I see some people right now, even dark skinned people, you can kind of see it like around the face. So some people are losing nails. I've seen people lose nails, hair loss. There is that rash, sores, body sores, different parts of the body. You have high fevers, on and off fevers. Then there is a complaint about a joint pain and fatigue. So I think those are some of the ones that I have seen and experienced some of those as well.
Okay, thank you, Mariam. Maybe what Mariam hasn't shared is that the research we have is mainly focused on signs of white people, which makes it difficult for many doctors to diagnose patients with a darker skin in Sub-Saharan Africa. For example, there's the butterfly rash, which is normally defined as a red butterfly rash. We have nail changes. There's also Reynolds phenomenon. The hand turns purple or blue. I don't know if we have any patients who have experienced that. So this really makes it difficult, including red spots on a patient's skin for doctors to diagnose this disease amongst like Black indigenous Africans or people with a darker skin color. Okay, so look at, sorry, Mariam, I'm so lost with this lupus thing. Could you please share some recommendations on how we can address the problems that we have talked about? And at this stage, I also invite the participants to share any recommendations they think would actually help address the challenges we have mentioned. The first challenge was the fact that it's difficult to diagnose the disease amongst people of color. Then there is also the lack of signs that is for people of color, that we have many signs of white people. We also talked about the disease mainly affecting women and lack of research for children as a challenge. We talked about the problem of decolonization. Also, the problem of colonization, so the need to decolonize, but how to decolonize the health sector so that people with lupus, including doctors, researchers, can actually receive more funding in the region. And here we invite any experience from any participant, regardless of the rare disease they're talking about, because that knowledge will actually help us come up with recommendations that are suited for lupus. We also have doctors in the room. They can also share more, including the experience that they have had, so that we can actually come up with some solutions. So this is the first part. We're now going to talk about recommendations as we continue on this journey. Thank you. So Mariam, you can go ahead, and then somebody can raise their hand, and then they will follow Mariam. Thank you.
Thank you, Derrick. Now, our biggest challenge when it comes to tackling lupus is the lack of knowledge. Lack of knowledge. When I say lack of knowledge, I don't mean that people don't know maybe what lupus is, but when you talk to medical people, also they'll tell you they only came across the condition maybe in a classroom. And it wasn't even a full session or a week, just briefly talked about, and that's it. We do not understand the disease. So even if the medical personnel is presented with all these conditions, with all the signs, it is not going to be easy for them to identify. Because as we know, it is a rare condition. It's not every day that you come across somebody who is living with lupus. That is one. Number two, our record keeping is not very good. So even if you're diagnosed, chances of this condition being you being directed to the right people to help you, it is not very supposed to go. When you have a condition like this, who are you supposed to see? Okay, so there is also that, and when it comes to women and children, for the children it's even worse because the condition is even fewer. There are fewer people who have the disease, children, I'm sure. Maybe the numbers are high, but because you do not have the right figures, you will never know. And when you look at women, as you said, you get affected in your productive age, between 15 to about 45. It takes away from you that you are supposed to give back to community, or you're supposed to give back. This is when you're supposed to be living your life, and you're cut off at that point. So it becomes challenging. It takes away from you. It takes away from your family. It takes away from your community. And since there isn't much support for people like this, you find that by the time you get to know what is wrong with you, you have lost time. You have lost time for yourself, friends. You have lost time. You cannot exactly pick up like everybody. So I think it is important that first of all, we streamline our medical systems. That in the event that a person is suspected to have lupus, they are recorded in the. I'm sorry, I don't remember the name of those books that we use for record keeping. Maybe one of the medics can help me. But if they could take down this information and follow up. But then that takes us back to our health sector. It is, I don't know whether I will say it's not well streamlined, but if there aren't enough numbers being affected by a condition, we are not paying enough attention to it, which is wrong. That doesn't mean that it is not there. And it doesn't mean that it doesn't. Because first of all, they'll tell you there is no funding. And even if the funding is there, how is it supposed to be allocated? I mean, you're not going to. I have had somebody pass on malaria or take away from things like malaria or TB or HIV to give to a small group of people, but that is not fair. Just because it is a small group doesn't mean that they don't need to be supported, and it is happening. Several times we have tried to get support, maybe in form of medication, or actually take a case in point. During COVID, hydroxychloroquine was hoarded. We tried to get it for our patients, and up to now we have never gotten it. And my question is, what is the shelf life for hydroxy? Why not give it out to people who are supposed to be using it instead of letting it go to waste? But the thing is, our medical system is not streamlined. We lack leadership. We lack people getting interested because, and in most cases, I'm sorry to say, but with our corruption, everybody wants to go where they are going to get something. They'll be able to go with something back home. So if you do not have enough funding, you're not going to get the support you need. Okay? So this brings back again to decolonizing. If we are able to have funds directed to the African indigenous Black person, and it is trickling down, even if it is small, it doesn't matter how small it is coming down to the people who actually need it, through the hands of the people who are actually going as far as the people on the ground are concerned, I think it makes much more sense. But as long as we keep giving the money to the white community so that they can decide for us, they are going to work within their surrounding and within their environment, and it will never come down to us. So still, it leaves us in a bad place. All in all, I think it starts with our medical system, from the awareness with the medical personnel, so that they can easily identify the condition, to where you go next as soon as they identify or even suspect. Do we have the systems in place that are going to take care of us? Do we have proper record keeping? I am sure if we come, at least we start with the basics, recording people maybe who have been diagnosed, and we keep them on record. I think it will go a long way in addressing most of these things. Thank you, Derrick.
Okay, thank you, Mariam, for your submission. So I think the things I've noted is that there is need to train doctors, so there is that lack of awareness about lupus within the Sub-Saharan Africa. And actually, I've been sharing some links to what lupus is, the signs of lupus. I'm also going to share research on lupus that has been carried out on lupus within the Sub-Saharan region. And as you'll notice, it's research that's been carried out by people from the Western countries. And when they come here, you will notice that they carry out research amongst doctors, general doctors, who unfortunately lack awareness about lupus, as Mariam has said, so they need training. But if you target, for example, like patients will know which rheumatologists are actually diagnosing lupus best, and can actually work with the researchers to reach out to these rheumatologists, or once granted the resources, they can identify the best researchers to carry out research on lupus within the region. So we also need research on the signs of lupus, because as you'll see in the research I've shared, or the knowledge, the general literature that exists is that the signs are actually white based. So we need signs that are also based on people of color. We need to reduce the criteria. Some of our doctors and researchers, actually special researchers, and individuals who are running nonprofit organizations in the Sub-Saharan Africa cannot apply for many grants that are outside the country, or international grants, because the criteria is so high. The criteria is in its own way exclusive. People who have so much experience, yet we're in a region where awareness about lupus is actually so low. We don't have projects on raising awareness about lupus. So realize that if you talk about years on working on lupus, are actually not as high as Western organizations that are working on lupus. That also includes researchers. We don't have so many researchers or research-led institutions that are working on lupus. So it's a disadvantage to them. Again, that goes back to raising funds. So decolonizing the system. And okay. And then actually using an African, let me just add to what you said, Lupus, another point. We need to use an African research approach, because many people or indigenous Africans do not have access to healthcare. So if you carry out research, you need to provide healthcare, you need to provide health insurance, so that we don't use one system of carrying out research like there is done in the West, where there's healthcare, health insurance. Africa, or the Sub-Saharan Africa, is different, and I think we need to use a different approach for carrying out research. So we need, again, more grants so that we can actually provide free services and actually record more cases of lupus. Unlike the current research that we have, it only focuses on research, therefore making many patients unable to access that research, given the fact that they lack healthcare. I'm going to share research on the study about lupus in Sub-Saharan Africa, which is going to do us to the next topic, that is the misdiagnosis of lupus in Sub-Saharan Africa. Mariam, could you share something about how lupus is misdiagnosed in the region? Before we continue, unless somebody wants to add something to the recommendations, please share. Actually, we have a question. Does gender have any role in researching This is asked by, okay. We have someone who's asking, does gender have any role in researching or collecting data about rare diseases in Sub-Saharan Africa? Mariam, can you answer that? Does gender have any role in researching or collecting data about rare diseases in Sub-Saharan Africa? Thank you. And please keep on bringing the questions. Thank you.
I think in my experience with the
Let me.
please do go ahead. Thank you.
I could respond to that. I just want to say, before I respond to that, I just want to really give a brief about lupus, because it seems the people that have it don't understand it. The doctors that treat it don't understand it. Also, our health system doesn't understand it. Why we look at Sub-Saharan Africa, I would rather look at Uganda in particular, because that's where I come from. I'm not an American. Anyway, this disease, it is in short form, you can call it SLE. Okay, so you can call it the word lupus is much as we call it lupus, but it's lupus. It is a word from another language which means fox. The reason they call it fox because it mimics other diseases. You can't know for sure unless you really have done so many gene tests and all that. It is really confusing. It is like a fox. You may think it is malaria. You may think it is HIV. You may think it is tuberculosis. You may think it is cancers. Actually, it has a lot of semblances with cancers. So it is really confusing. Nobody understands it, seems. So it has, because it resembles other diseases, it has symptoms that mimic all other diseases. In other words, it affects the head from head to toe, inside and out. All the systems inside this, the person and outside the person, it will affect them. Just like we said, it is an autoimmune disease. In other words, the immune system is fighting its own body, a situation which should not occur naturally. So your immune system, your cells which fight off other diseases, recognize your own body as a disease, so they begin to fight it off. That is why it will affect any part of the body which has blood. As long as blood reaches any part of your body, the disease can manifest in that area. The brain, the hair, the tongue, all the organs and systems, kidney, everywhere can really affect it. That's why it's very hard to understand. So you have to treat it using medicines which stop your immune system to react. In other words, the medicine is telling your immune system, hey, don't react, you know? And when you tell your immune system not to fight, basically you are telling it that now open up to any other diseases which come because you're not able to fight. The medicines that you give such people are lowering their immunity such that it doesn't fight. That is what the PrEP does. That is what all the disease, rather the medicines have. That's what they do. In other words, you've opened up to all other diseases to the person because the system cannot really fight. So that is where it gets complicated. About the health systems, yes, it is not even mentioned in the rare diseases. When you look at the Uganda calendar, medical calendar, it's not even mentioned anywhere as being part of the diseases in Uganda. It is not looked at. When you look at, we have what we call forgotten diseases. It's not even part. In other words, we have reduced awareness for it among the people, the community, but also the health workers. Putting that aside, what are the recommendations? The recommendations are, one, people that have it really their Bible scripture should be taking the medicines that they are given. When you skip those medicines, trust me, you will get flares. And I've seen people who go to church, who go to mosques, people who take holy water, Pastors will tell them to stop taking the medicines. But once you get off that medicines for a week or so, trust me, you're going to get a flare and it will be bad this time. So the number one recommendation is take that medicine biblically. That's 1. 2, what do we need? That's on a personal basis. Use the sunscreens because it will disorganize your skin. You'll get lesions on your skin, meaning the UV, ultraviolet rays of the sun affecting you. And remember, ultraviolet rays of the sun can cause cancers. In other words, you're prone to getting cancers. Therefore, you should use sunscreens. You should use those big hats and caps while you're traveling or going outside. Basically, you have to behave like you have to protect yourself like how albinos do, because their skin also is predisposed to getting cancers. Now, what about in the general population? I think we need to create awareness. For this disease, and we have to do it ourselves and sell it to other people. People don't know about it because we are keeping quiet. We are not selling the disease to other people. And the number one point where the health system comes in is buy-in from the political aspect. If we have any political leaders that we know of, it is really important that we interest them, because most of the health policies are done politically, and then they manifest into the health system. So we need to really create that awareness and political buy-in such that people can know about this disease. I know of a drink which is
I'm sorry,
Red Bull.
Dr.
Red Bull is.
I'm going to cut you short because the time is almost up. We're finishing
Okay.
at the top of the hour. Yes.
You could invite me for another session. I will talk for 3 hours. I will not stop.
You could add, you could share more in the chat, so that we get to know more about lupus, so that we can actually learn more from you.
Anybody who within a second, I think my number will be available in the chat. Anybody can reach me. I've treated clients with lupus. I'm an advocate for lupus. Well, I'm also dedicating part of my time for lupus, apart from treating cancers and other women issues. Thanks, and over to you.
Okay, one last question, Dr. Vega. Are you a rheumatologist?
I didn't get your question well.
I wanted to know if you're a rheumatologist. Are you a rheumatologist or a specialist in the health sector somewhere?
Hello, I didn't get the question well. Please come again.
Okay, thank you. I think we shall talk more later. Okay.
I'm an oncologist, but okay.
Okay, thank you. We still have a question from Ondurache. I don't know if I've pronounced that right. Please, you can correct me. He has a curiosity. Okay. Does gender have any role in researching or collecting data about rare diseases in Sub-Saharan Africa? So to respond to that, autoimmune diseases like lupus mainly affect women around the world. So because they mainly affect women, there is limited funding that goes to women-led initiatives on the continent and actually around the world, especially those that are working on issues that are related to indigenous people, like Black indigenous Africans. For example, like in our case, there is close to zero or no funding for lupus. So because there is that gap or difference when it comes to funding women-led initiatives or diseases that mainly affect women, does affect research and collecting data, especially in relation to autoimmune diseases like lupus. So please, if you have anything else to add, this would be the perfect time. I think we are going to stop here because it's almost time up. So if you have any question or any comment you want to add about lupus, please share, or any rare disease that you know. this is the perfect time. So please just utilize this time. And please, if I haven't answered your question right, you can continue sharing more in the chat so that we can find a way of answering the question best or discussing about lupus. Thank you. So kindly raise your hand if you have a comment or a question, anything that you want to share, or you can continue using the chat so that I can get to choose your question or comment. Thank you. We could also get something from a patient with lupus. You can share something, a story about yourself. Please feel free. Okay. See, we're only remaining with 3 minutes. Maybe within these 3 minutes, you could use it to send somebody, like Dr. Lubega, a private message and chat about something, or anybody else your phone you've taken interest in, and continue network or chat. But with these last minutes, let me just ask Mariam to share something about the misdiagnosis of lupus. So which are the common diseases or conditions that are actually thought to be lupus, yet in reality they are not? Thank you.
Thank you, Derrick. In most cases, I think what they misdiagnose is because of the fevers, malaria, which is prone to our African setting. I've had cases of typhoid, malaria, cancer, HIV, given the age bracket and the timing when the disease sets in, and ulcers. I've known people who have been treated for ulcers. Recently, there's a patient who has been diagnosed with lupus, but they have been treating rheumatoid arthritis for the last, I think, 7 years. And they were treating that. She doesn't even have rheumatoid, but because the symptoms were there, they were treating that. Kidney failure, in the event that it is not caught early and it goes all the way to your kidney. So I think those are some of the conditions. The others are a bit more scientific. Some of them I don't even know how to pronounce. So, but I think those are the ones that I've heard of mostly.
Okay, thank you. Let me summarize that and then we can close this meeting. Mariam has mentioned conditions that have been, or diseases that have been misdiagnosed, or how the conditions that have been used to misdiagnose lupus. That's better. We have had ulcers. There's also chronic ulcers. So they just tell you that you have ulcers for life. That's my own personal case, I'm one of those people. Anemia, I've actually shared research. Anemia is the common misdiagnosis for lupus within the Sub-Saharan Africa. But before someone is misdiagnosed with anemia, there are a series of conditions that they are diagnosed with before anemia. Anemia is what takes you to the hospital because it's very severe. And then after anemia, when the doctors have actually concluded that it's what you're suffering from, you continue to be misdiagnosed with other conditions or diseases, including mental illnesses like obsessive compulsive disorder, that according to some psychiatrists, apparently accompanies mental autoimmune diseases, which is not actually true. But the one thing I want to end with is that if somebody is suffering with chronic conditions without the medication actually being beneficial to them, for example, like malaria, somebody is always being diagnosed with malaria. You've heard of statements like "Or the fever is hidden." That patient should actually seek for better help or health services. And we are here to provide with the right advice We have doctors like Dr. Vega who can actually support patients who have chronic ulcers. Ulcers heal, so it's pointless for someone to tell you that your ulcers don't heal. No, you've just been misdiagnosed. If your HIV test comes back negative, you do not have HIV, you need to find out what you're suffering from. And as Mariam said, that lupus actually, as Mariam and Vega said, Dr. Vega, that it mimics other diseases. It's like a fox. So you need to also consult better healthcare services or doctors, rheumatologists to find out what you're suffering from instead of being misdiagnosed with HIV/AIDS um, because sorry, yeah, it's okay. You can jump off. It's okay because we have really gone past the time. Because the doctor doesn't know what you're suffering from. A negative HIV test means that you do not have HIV, so you need to seek or look for a better diagnosis and better healthcare services. Okay, other than that, thank you all for attending. I think this is it, unless someone has questions. Thank you for attending, and you can say bye to one another. Those who are interested in networking, we have about 15 minutes to try and talk to one another. Otherwise, thank you. Mariam, you can share something if you want to, but otherwise, this is the end for all of us. Thank you.
Thank you, Derrick. Thank you for having us, and thank you for this session. I hope we can have many more in future, and we can meet and talk, maybe discuss more on way forward, and maybe networking. I think networking would be a good way to go, because if you do this alone, it doesn't really go far. And
Yeah, true.
unfortunately, I think I'm going to have to run also. I'm supposed to be somewhere in the next 10-15 minutes or so. So I think I am going to leave you now, if it is okay.
Okay, before you run, one last thing. Let us how they call it? Let us show our videos so that we can take a photo, a group photo. People okay with that?
Yeah, I'm okay with it. I don't know about the
Yeah.
others, but I'm okay with it.
Please start your videos so that we can take a group photo.
I'm sorry, I cannot put on my video because I'm in a place which is really not appropriate. I'm sorry about that.
If you can, please turn on your video so that we can take a photo. If you can't, it's understandable. I think someone has a question. I think it's about the ED. Okay, everyone, thank you. Let me say bye-bye for now.
Okay, thank you, Derrick.
Bye-bye. Thank you for attending. It has been super fun.
Thank you for having me. Okay.